Hello, my name is Ching Sang Par. It's a great honor to be here and to have opportunity to present our research in this section. But I'm going to talk about the prescribing trends, psychotropic drugs, against children and adolescents and association with polypharmacy reduction policy for psychotropic drugs based on Japanese National Database Survey. Polypharmacy is common global phenomenon. Several polypharmacy studies have been conducted in many countries, and most examine elderly patients. Concerns about polypharmacy in pediatric patients are also rising because of the increasing number of prescriptions used to treat mental disorders interventions in pediatric patients. The number of children prescribed psychotropic drugs is expected to increase also in Japan. The Japanese government reported 270,000 as of the total number of patients with mental disorders under the age of 20 in Japan in 2017, which is about 2 times higher compared to the number in 2002. Moreover, it is expected that they will be prescribed psychotropic drugs with risk and benefits already not yet been completely established for the administration in pediatric patients. Therefore, the Japanese government's polypharmacy reduction policy, which reduced the reimbursement of medical costs, was introduced in 2012 to address unnecessary psychotropic drug polypharmacy. This figure 1 shows the Japanese medical system. The health insurance system covers all citizens and residents in Japan. The Japanese health system is based on fee-for-service reimbursement under a uniform national tariff schedule. Here, review and payment organization validate all health insurance claim data. And this table summarizes the polypharmacy reduction policy for internal or psychotropic drugs under the health insurance system. In the policy introduced in April 2012, when 3 or more types of psychotropics were prescribed at one time, the reimbursement rate of the fee for continuous clinical psychiatric outpatient service or consultation was reduced by 20%. However, this polypharmacy reduction policy is that severe patients who need high-dose multiple drugs are also comprehensively evaluated with the same reimbursement rate of medical fee claim criteria. In particular, it is questionable whether the prescription of polypharmacy decreases over time after introducing a policy. Moreover, there have been no reports on the effect of the policy on pediatric patients in Japan from the reimbursement of medical fees using a large-scale healthcare claim database. So the purpose of this study is to examine the impact of the polypharmacy reduction policy on the amount of psychotropic drugs prescription in pediatric patients using a large-scale Japanese national healthcare claims database. We used the open data were obtained from national database. It's called NDB. Between April 2015 and March 2019, we assessed the amount of psychotropic drugs prescription 0 to 19 years old outpatients in or out of hospital prescription fee. And polypharmacy also increasingly common in elderly patients. Therefore, we conducted an additional survey for elderly patients aged over 65 years old. And we are going to take you through some of the results about elderly patients. And the NDB data were aggregated by these 5 types of psychotropic drugs. And the Reiner regression analysis was used for statistical verification. This figure 2 shows about the structure for NDB database used in this study. NDB is a National Administrative Claim Database. The Japanese government promotes this database. The NDB covers more than 126 million people and 19 billion electronic insurance claims annually, with data from 99% of the hospitals in Japan. And data extracted from the NDB are provided to national administrative purpose, and researchers were after analyzed information about specific patients and medical facilities. And the government also began to provide for free access version of the NDB open data. The NDB open data were constructed by aggregating a part of the NDB data without any complementary information. Therefore, researchers using the NDB open data cannot access patients or facility level information. So, as shown in this slide, what we found is that the prescription trends differed depending on the types of psychotropic drugs and in or out of hospital prescriptions. As demonstrated in result figure, the amounts of in-hospital prescription for all types of psychotropic drugs for children and adolescents showed a decreasing trend in recent years, including hypnotics. On the other hand, the opposite tendency was observed for out-of-hospital prescription for psychotropic drugs. Although statistically not significant, a Reiner regulation analysis showed that the out-of-hospital prescribed amounts of antidepressants and hypnotics tended to increase over the years. As shown in this slide, according to the results of prescribing trends for psychotropic drugs in elderly patients, the proportion of prescription among in or out of hospital antipsychotics, anxiolytics, hypnotics, and benzodiazepines significantly decreased from the previous year. On the other hand, the amount of antidepressants prescriptions significantly increasing trend in years. As we showed earlier, pediatric patients also were increased trend to the out-of-hospital prescription amounts of antidepressants. So this study demonstrated that the polypharmacy reduction policy for psychotropic drugs was associated with reductions in hospital prescription for pediatric and elderly patients. This means in Japan, many acute medical institutions also provide in-hospital prescriptions. Therefore, evidence does seem to show that the reduction effects is due to the drug reduction efforts of acute medical institutions, which have many patients with high severity. However, key points of this policy basically targets a reduction rule for just the number of multi-drug prescriptions. So additionally, an effective policy for polypharmacy reduction should be established based on clinical guideline while also keeping the quality of medical care. So this study suggests that in these retrospective nationwide population-based studies, attention should be paid to whether the evidence is policy effects or an in-hospital internal maintenance updates. Additionally, future research is needed for retrospective comparison using real-world data and national database for verified factors and clinical quality with no statistically significant difference. Thank you for your attention.